My name is Dr. Sunil Sharma, and today I'm going to talk about gastric bypass, also called as Roux-en-Y gastric bypass. So, gastric bypass is one of the oldest operation which is still quite popular today. It works on two principles. One is called restrictive component, in which we try to reduce the size of the stomach, so less food is required to reduce the fullness, and you eat less and you are satisfied. The second component is called malabsorptive component, and in this we try to rearrange the plumbing, the intestines, by making few connections so that the food travels through one passage and the digestive juices travels to the other passages, and the mixing of these two takes place at the later stage. So the food is not mixing with the digestive juices, so practically there is not much digestion going on and less calories are absorbed. For example, you take in 2000 calories and only 1400 may be absorbed. So based on these two principles, restriction, in which you create a small stomach, we call it pouch, and malabsorptive, this operation works well. It is one of the most popular operation along with sleeve gastrectomy. It is little complex in terms of reconstruction. Traditionally, this operation was done open, where you make a big cut and do all the cutting and sewing, and it was very painful and would take a lot of time to recover. However, nowadays, for last 10-15 years, most of these operations are performed laparoscopic through tiny holes, where you put the instruments, look at the camera, and do the whole operation. Takes about 90 minutes, and the hospital stay is typically 1 day. More recently, people have started using robot in doing this surgery. I've been using robot for last few years and found it very useful in terms of quick recovery, less discomfort to the patient, early return to work, and less complications. So the approach can be laparoscopic or robotic. Now, Roux-en-Y gastric bypass is just the technical name given to what we do. It's not same in every patient we do. You can modify the technique. For example, you can make pouch, which is the new stomach, really small, medium size, or large size. You can also change the size of the connection between the stomach, pouch, and the intestine, so it can be 1 centimeter, 1.5, 2 centimeters or more. And you can also change the length of intestine which you are bypassing to increase the malabsorption. So depending on the patients, their profile, medical conditions, their expectations, you can tailor this operation based on their needs. Few things are very important after gastric bypass. As it is malabsorptive operation, you need to take your multivitamins, specifically vitamin D, iron, B12, and others. And we typically check the blood work every year to make sure what you're taking is adequate. So we don't want you to get any deficiencies. Certain things are really need to be avoided after gastric bypass. Use of certain pain medications, particularly NSAID, Motrin, and there are other medications which cause gastritis, should not be used for long term. Smoking is a big no. If you smoke, then you are sure to develop ulcer. So you have to bring right changes in your lifestyle in order to make this operation successful. If performed in a right way, it has a good long-term success in terms of weight loss, as well as cure for your medical conditions like diabetes, blood pressure, cholesterol, sleep apnea, so on and so forth. It's also indicated in patients who have severe reflux and have obesity or morbid obesity. It's the best cure for reflux. Instead of doing a fundoplication, you repair the hiatal hernia and do a gastric bypass. It's a low pressure system and increases, and it's very effective in reflux. It's also effective and needed when you have a biliary reflux. That means bile is leaking into the stomach from the intestine. So you need the diversion. So you have the choice of either doing a duodenal switch or a gastric bypass. So in selective indications, it has really good long-term results. What's the disadvantage? Well, this is an operation which is called a final operation, meaning you cannot modify this operation. You had a gastric bypass, now you say I need to have sleeve or DS or anything else, then it's not possible. However, with other operations like sleeve, it can always be converted to bypass or duodenal switch. So these are the advantages and disadvantages of gastric bypass. In selected patients, this operation works really well. If you want to know more about this surgery or want more information, please visit sharmasurgery.com, or you can call 904-399-4004. We'll be happy to assist you and help you. Thank you so much.